Hello everyone, welcome back to our channel. Today, I'm going to talk about a commonly used medicine called Voren injection. Many people have heard of it or even received it, but they are not always sure what it is, how it works, and when it should be used. So let's break it down in simple terms. Voren injection contains a medicine called diclofenac sodium, which belongs to a group of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. These medicines are used to reduce pain, inflammation, and swelling. Voren is usually given by injection when fast relief is needed, or when someone cannot take medicine by mouth, for example because of severe pain, vomiting, or after surgery. Doctors commonly prescribe Voren for conditions such as joint pain, muscle pain, back pain, sprains, sports injuries, post-operative pain, or even painful conditions like renal colic, which is the sharp pain caused by kidney stones. Because it works quickly, it is often used in emergencies where oral tablets might take too long to act. Now, let's talk about how it works. When our body is injured or inflamed, it produces certain chemicals called prostaglandins. These chemicals are responsible for pain, swelling, and fever. Voren works by blocking the enzyme that makes prostaglandins. By stopping their production, the medicine helps reduce pain and inflammation and brings down any associated fever. The injection is usually given intramuscularly, which means into the muscle, most often in the buttock. In some cases, a doctor may give it intravenously, but that depends on the situation and should only be done in a hospital or clinic by trained professionals. The dosage and frequency depend on the patient's age, weight, and the severity of the pain. Typically, a single dose or a short course is given. It is not meant for long-term use as an injection. Like all medicines, Voren injection can cause side effects, and it's important to be aware of them. The most common ones include pain or irritation at the injection site, stomach upset, heartburn, or nausea. Because it is an NSAID, it can sometimes cause stomach ulcers or bleeding if used repeatedly or in high doses. Rare but serious side effects include effects on the liver, kidneys, or heart. People with a history of stomach ulcers, bleeding disorders, heart disease, kidney problems, or those who are allergic to NSAIDs should avoid this medicine unless specifically advised by a doctor. There are also some important precautions. Voren should not be used during pregnancy, especially in the last trimester, unless a doctor decides it is absolutely necessary. It should also be avoided in people who have asthma triggered by painkillers, or who are already taking other medicines that can irritate the stomach, such as steroids or blood thinners. Alcohol should be limited, as it increases the risk of stomach bleeding. And of course, never self-inject this medicine. It must be given by a healthcare professional. Many people ask, is Voren stronger than regular painkillers like paracetamol or ibuprofen? The answer is that it's not necessarily stronger, but it is faster acting and more suitable for acute, severe pain when tablets are not enough or not possible to take. However, it is not a cure for the underlying disease. It only helps control pain and inflammation while other treatments address the actual cause. Finally, remember that while Voren injection is very effective when used correctly, it is not for casual or frequent use. Always take it only on a doctor's prescription. Follow the recommended dose, and inform your healthcare provider about any medical conditions or medicines you are taking. If you notice side effects like black stools, severe stomach pain, swelling of the feet, or difficulty breathing, seek medical attention immediately. So that's a clear overview of Voren injection, what it is, how it works, when it's used, and the important safety tips to keep in mind. If you found this information helpful, please give this video a like, share it with friends who might benefit, and subscribe to our channel for more pharmacist-approved health tips and medicine explanations. Stay healthy, and I'll see you in the next video.